Hello everyone and welcome to Prevention Matters, a special segment under Cancer Matters brought to you by the National Cancer Society of Malaysia with support from Takeda Malaysia. While Cancer Matters often focuses on cancer care and treatment, this segment highlights a broader truth that prevention and early action are essential to protecting long-term health. Today, we're turning our attention to an important public health issue in Malaysia, dengue fever. Although dengue is not cancer, its impact on communities, healthcare systems, and vulnerable populations make prevention a matter we cannot ignore. Joining me today are Dr. Kosulavani Shanmugam, a physician who will share medical insights on dengue, and Kaisin, a university student who will bring in the youth and community perspective on awareness and prevention. Welcome. Thank you so much for being here. All right, so we could just jump on to the first question. Doctor, dengue has been around for many years. So why does it remain a major concern in Malaysia?
All right, thank you for your questions. So firstly, our environment strongly favors dengue mosquito. Reason being is because warm climate, frequent rainfalls, high humidity, all this is actually creates a very conducive environment for the Aedes mosquito to breed all year round. It's basically like a 5-star resort for them. So on top of it, we have urbanization, high-rise buildings, and also all these water containers, which helps them to breed. Number 2, population and also mobility. So studies have shown that dengue can spread faster in a very high dense population, and because in cities like KL, Penang and all, we have a lot of rapid movements to work, to offices, to breeding homes. So all this increases the rapid transmission rate. Number 3, dengue has many strains, right? We have 4 serology, and doesn't mean that once you got infected with one, you won't get infected by other. In fact, after you get first infection, your subsequent infection can be severe. And the last one is, the dengue control is very challenging because despite fogging and also a very good infection control, the dengue are very resistant. So to answer your question, it is a very big concern for us, yes, not in terms of the healthcare, but also in terms of the economic burden, because government is spending so much money in curbing the disease and also in preventing.
Okay, some people think that dengue is just a bad fever. So do you think that this is accurate?
Well, this is a very common misconception. So the thing is, dengue is the tricky part is dengue comes like a normal fever, but while some other people can easily escape with minimal symptoms, right? But actually, the dengue's complication is life-threatening. You have bleeding tendency, you have hypotension, dehydration, and even multi-organ failure, which can lead to death. All right. So my take-home point is, if you seek early treatment, you should seek early treatment, and that's where some people delay the treatment. That's where this disease gets dangerous.
I see. All right. Thank you. So Kaisin, from a student's point of view, how aware are young people about dengue?
Thank you for the question also. Just like what Doctor have mentioned, I think young people, we don't really take dengue as a serious case. All we know is just dengue is like comes from the mosquito. Then it's actually we're only really aware about this dengue fever when we have someone that is close with us, this dengue symptoms.
Okay, so do students actually actively practice dengue prevention?
Not exactly though, because like dengue is always we always think of this topic like everywhere, but we doesn't really get any awareness about this because we don't really use repellent, and also we don't really check for those stagnant waters, which we also have I don't know whether is it a misconception, doctor, if you can correct me. We think that dengue is only will appears on dirty areas.
Okay. It's a myth, no, because dengue happens in a clear, stagnant waters, and even a small amount of water, the mosquito can easily breed. Yeah. Right. Thank you for clarifying.
Here.
Right. So, what are the symptoms that people should be alert to?
Alright. Basically, dengue, I will just divide it into three phases. Febrile phase, where you get fever. Critical phase, this is the utmost dangerous phase, and recovery phase. So febrile phase is where it acts like a normal fever. You have fever, headache, body ache. But once the fever subsides, that's where your clock ticks, because that's where the critical phase kicks in. If you have persistent vomiting, abdominal pain, extreme lethargy, poor oral intake, these are all the signs that you have to seek medical treatment urgently, because all this, if not properly treated, it can lead to death.
So, is self-medication safe and okay when someone is suspected of dengue?
I would go for no, because some medications can cause increased risk of bleeding and also can damages your organs.
I see. So, when we think about dengue, it's always like we rely on fogging, right? So, is that enough?
Okay, so basically dengue prevention, right? It's a multi-layered approach. So fogging is just one layer. So why fogging is not enough? Because fogging only kills adult mosquito. Okay, where just simply like you're doing a quick cleanup and all the breeding sites, right? The baby mosquito and the larva are still there. So when fogging only kills the adult, so after a few days, this baby mosquito comes and give you a comeback. So you're not eliminating dengue. It's just a part of the one layer protection.
All right. So, what about vaccination? So, vaccination, is it another layer of prevention, protection?
Yes, I strongly agree with you. So, like I said, it's a multi-layered prevention. One is, of course, environment, fogging, removing stagnant water. Second is personal, like she said that repellents, proper clothing, right? Number three is, of course, like what we are doing, community awareness. And number four, the new thing is we have vaccinations. So vaccinations is strongly advocate, and if you're eligible, right, and if you're suitable, so vaccination adds on as a protection. It doesn't replace the control, but it adds on as a protective layer.
See. So, some people are unsure of vaccination. What advice would you give?
Okay, it's very common to have a lot of questions about vaccination. All right, so first thing, dengue vaccination, it reduces the risk of infection and also hospitalization. All right, so the decision of vaccination actually should be based on medical advice, an individual risk assessment, and also the eligibility lah. So I would like to say that all vaccines usually undergo a rigorous scientific evaluation in terms of safety and also efficacy. All right, so all the vaccinations usually they are safe because they undergo multiple trials before they get into the market. And even after being on the market, you'll have a continuous monitoring of their safety purpose. So go and consult your doctors about vaccination.
Okay, thank you. Kaisin, how can young people contribute to dengue prevention?
Yeah, this is also a very good question. It's mainly young people can actually play a big role in terms of keeping the surrounding clean, participate in community activities, like what Doctor have mentioned, and also mainly to share accurate information about actually vaccination is safe, what Doctor have mentioned, and also more towards to keeping everyone to have a care sharing session, which is quite powerful and impactful lah, because only friends we get like more connections, so that sharing of very accurate information is very important in terms of this.
Yeah. Okay, so I think we have reached the end of our podcast. So before we end, one key message from each of you. Maybe we can start with Kaisin.
So prevention starts from everyday action. So please don't wait until dengue affect your close one. So in order to reduce you from the risk of this dengue, and also to actually don't let you to miss out the important exams in your life as well. So I agree with Doctor that we should actually take initiative, take part in community event, get protected by yourself by taking vaccine.
And of course, from Doctor.
Yeah, I second what Kaisin has said. So I would like to re-emphasize, dengue is a prevention. So education, early detection, seek doctor on time, and of course continuous prevention strategies is the most important thing so that we can curb the disease and prevent the disease altogether. Thank you for inviting me.
Thank you so much. Thank you to our speakers and to our listeners. This podcast is brought to you by the National Cancer Society of Malaysia with support from Takeda Malaysia. Stay informed, stay protected, and let's work together to reduce dengue in our communities. Thank you.